A stroke or traumatic brain injury to one side of the brain is a life-changing event that causes the other side of the body to become super weak, completely changing the way a person gets out of bed, stands, and walks. There's so much asymmetry. Gosh, where do we start to help this person recover? I'm Dr. Allison Wu, physical therapist and board-certified clinical specialist in neurologic physical therapy, and today we are going to try to help you, the non-medical type person or student, to figure out each of these challenging movements that we take so much for granted in a series of videos. Did you know that our brain has a really complex, cool map of our entire body? It's an amazing GPS system in there. In general, we have two maps on each side of our brain, one to tell our muscles to fire like light bulbs in a house, the motor map. The other map feels anything touching us, feels for where our body is in space so we can walk around at night without looking at our feet. This is a sensory map. Isn't that amazing? Damage to one side of the brain from either stroke or traumatic brain injury damages one or potentially both maps. That is why half the body, face, tongue gets so weak and or numb. The body's not the problem. The light bulbs are all off because the brain needs a map to talk to them. Sometimes the maps are so damaged that one side of their body is like a noodle. The patient needs 50 to 90% help to lay down and get up. When a patient needs so much help, they most likely will be on a medical bed with an air mattress type setup to prevent pressure ulcers from developing. Let's talk about how to help them get up and lay down in bed. Most importantly, first, put the air mattress to the firmest and static setting. Some beds have dynamic airflow, so the bed's always moving. Now, I'm petite, and all my patients are giants in comparison. After 11 years of seeing miracles in an intense inpatient rehabilitation hospital, this is the easiest way I've found to help my patients move and get stronger. So when the patient's in the hospital, especially if they're not very able to move, they're typically on an air mattress. And if they're sitting too close to the edge, their hips tend to slide off the edge. One side of their arm and their trunk and their leg is crazy weak. So you can see if I try to scoot him back into the seat, I can't get him anywhere because his knee is below the hip and this friction right here is stopping him from moving. This works for tall people and short people, especially when the mattress doesn't lower enough. So I pick him up by his knee, I support with my legs like this, I use my body, I take the friction a little bit and I lean him over to the other side and then I can just scoot. Okay, and if their full entire body is really weak, then I can do the same thing. On the other side, Alex is helping tremendously, and so on and so forth. Once you have them scooted back in the seat, they're in a safer position to lay down. We can keep practicing this. I'm going to take the leg and you can see he's already starting to move if I just pull forward and scoot him to the edge. And scoot him to the edge. He's all the way back down. Okay? And back. Good. And back. A bit higher and back. Now, if the pillow is really far away and I lay him down right here, his feet will be off the foot of the bed. If this is a very low-level patient who can't really help, then I can take them and scoot them. I like to grip both their legs, get them forward into my space. Relax, please. And then hook my chin over their shoulder. They can hug me. Sometimes that helps. They take their hips. There we go. Make sure they're leaning forward. I lean forward. Don't help me. Okay, I move this way. Try not to help me. Okay. And I lean back and scoot them. So in a more sturdy bed, where the mattress is fully firm, this is a little easier versus this bed is sliding a little bit. Okay? Cool. Now he's closer to the head of the bed where there's usually a pillow. So then right here, I'm going to again scoot him back in the seat. And scoot him back. And scoot him back. And he's sitting safe. Okay? If the patient is a strong pusher, sometimes I will even wrap my arm like this to gain control over their hip and their trunk for positioning in bed also. Okay? So first thing first, and being able to move in bed if they are in bed, is to help them roll. So usually it's the easiest to tell them to bend one knee. So let's bend your strong knee. If they were not able to help, you can help underneath the knee and then the foot, and together follow the patient, okay? And then they reach their arm across, their stronger arm. Usually in a medical bed, there's a railing, and then you have them roll this way, okay? Good. And then go back on their side. Another way to do it that uses the abs more is he brings, so I'm not blocking. Reach this arm for the quote unquote rail and bring this knee up towards your chest, and you're using your abs to roll. Perfect. And come on back. Now this one, you're going to push this leg down into the bed to push yourself onto your side using your butt. So there's two ways of rolling that you can practice. Okay? Good. And come on down. And then for the weak leg, bend. You notice that I'm using my arms, my body's doing most of the motion. So it saves all of this from working too hard. And then you can use all this to roll. And there's rolling mechanics. For getting out of bed and laying down in bed, one of the most important things is to make sure they're not too close to the edge they're trying to get up on. If they're too close to the edge, you can imagine by the time they roll onto their side, they're about to roll off that side. Now, I like to make sure I have a chuck pad or a flat sheet underneath their hips, especially if they're crazy weak and their body in their trunk. So I just get an extra flat sheet at home. Okay, and this is about hip width for his hip to his leg. And I roll this up about halfway. Okay. And we're going to roll to one side. So roll slightly to that side. Good. I'm a little close to the edge, so I'm just going to shove this. Now, I like to make sure this is behind his knee and this is slightly above his hips. Okay, and come on back. Okay. Roll to the other side. Perfect. Okay, now I have a nice sling for his butt, especially when he's extremely weak. Now, when he's in bed, let's say he's laying too close to the edge, then I can also use this to reposition. If I want to scoot him closer to this edge, I take the sheet. Don't help me pretend you're dead weight. I just scoot. But notice again, I'm using my hips and I'm not trying to use my arms and my back. So now he's closer to this edge. If they're not able to do this themselves, this is a very useful technique. And I'm going to scoot him back over towards me, and actually starts him rolling. And take that with us. Okay? We're going to work on sitting up. Okay. So I can also use this for someone who's really weak to actually help them roll as well. Okay. Use my entire body like this. And now he's on his side. Now, looking at the side of the bed and how much space he has, By the time he gets his feet off, his hips will be sitting too close to the edge. I like enough bed space where the whole leg can fit on it. Ways to position them in this. I take his legs up. Make sure the sheet is nice and flush with him. I have total control over the material. And you're going to pretend to be dead weight for me, Alex. I take both legs up like this. Okay. And I grab the bottom of the sheet, the back of the sheet, and I can scoot his hips away from the edge. Now he has more space. Okay. Most important part of this, practice both sides. He's going to be taking this hand to push off the mat to help me. Okay. Now I have a pretty wide stance. Okay, so I get him to bring his knees towards his chest first. Kick your feet off. Now, for the weak leg, it tends to flop. So my back leg is here to help it lower slowly. Make sure this is underneath his bottom. Okay. All right. And then you're just going to help a little bit. Okay. So I have a nice wide stance. I can lift your head up a little bit behind his shoulder blade and together lift up. Good. And ideally, I like to try to help get the arm onto the bed for a weaker stroke and try to help them and all the way up. And then I square his hips up and he's safely sitting at the edge of the bed. Okay? Now, I always keep a hand on my patient in case their trunk flops. Notice that my hand is actually behind the shoulder blade, not the arm, or I will cause a shoulder dislocation in this joint. So I'm always behind and checking he's safe on the weaker side. Okay, now I like to switch the pillow to the other side and practice both sides. He's sitting a little bit close. So I have this sheet, super handy. I'm going to scoot him over. Okay. All right. I'm going to make sure he's coming forward. And I can use the sheet to scoot him pretty nicely. Okay. And then we're going to work on the next step is laying down. The most important thing about laying down is everyone just wants to lay back. But if they lay back, they're going to flop down at a diagonal. Let's show them a good one, then we'll show them a bad one. Okay, so I like to have them reach this arm onto the bed, weak arm across the body, and really focus on laying down on their side. I'm making sure this stays on the side and this comes up onto their side. I don't really care about the strong leg. I tell them pick it up, get it up, get it up. Good. And now they're safely on their side in fantastic position. Okay? The way we practice this side, this helps the brain flip sides, get their midline awareness back into the middle. Okay? So again, make sure on their side, knees towards the chest, bring your knees up together, kick your feet off the side, and then sit on up and together. Okay? So you notice my arms are not doing a lot of the lifting. It's a full body motion. Okay? We'll show them a bad laying down. So in a bad laying down, people try to lay back like this and princess carry their family members like this. And they're at this fantastic diagonal. Usually they tend to be at a fantastic diagonal, and it's a lot of work for the family members. So I like to take it step by step. So again, on our side, okay? Knees towards the chest. Kick your feet off. Okay, my legs here and together. A little bit. And up. All the way, let the leg go. Straighten that out. Good. Okay. This takes quite a lot of practice. It's a fantastic full body workout from head to toe, arms, trunk, and legs. Sometimes I'll spend a whole session with a patient laying down, getting up, switching sides 10 times straight. And it's a huge workout. Fantastic recovery for the trunk, the leg, and the body, and the brain's spatial awareness of where it is in space, especially with one side of the body being more numb and weak. The brain's feeling for where the body is in space is now very off. Look for our next video on scooting training, standing up and sitting down mechanics. Let me know if you tried any of these strategies and how they work for you. I'm Dr. Allison Wu. Remember, we heal smarter, not harder.